Good morning, students. Today we are going to talk about the prevention and treatment of injuries. My name is Derek Spence, the PE and sports teacher at the Mac CSE. Let us look at what an injury is. An injury is a damage to the body. When we are talking about injuries, we're talking about soft tissue and hard tissue injuries. Soft tissue injuries are injuries to the muscles, tendons, ligaments, or joints. Examples of soft tissue injuries are sprained ankle, torn hamstring, skin abrasions, lacerations, and blisters. Hard tissue injuries are injuries to the body's hard matter, such as the bone. Examples of hard tissue injuries are a broken finger, a broken ulna, the long bone found in the forearm. Sports injuries develop in two main ways: acute and chronic. Acute occurs suddenly while you are engaged in a game, for example, basketball, soccer, badminton, tennis, etc. Chronic occurs over time from overuses. Bruise or contusion. A bruise or contusion is an injury to the soft tissue often produced by a blunt force such as a kick, fall, or a blow. The result will be pain, swelling, and discoloration. Blisters are caused by friction from shoes or clothing, which rubs repeatedly on the skin, causing friction burns. As the outer layer of skin separates from the inner layers, the space between fills with lymph fluid. Blisters are caused by new shoes, having on shoes for a long time, for example, marathon athletes. How can we prevent these blisters? Well, we have to ensure that shoes fit correctly. Protect the potential hot spots by applying a second skin and/or taping. Keep feet as dry as possible. Wet shoes, boots, and socks will cause blisters far quicker than dry ones. Wherever possible, change socks regularly and use foot powder to help keep them dry. Break in new shoes and gloves. How can we prevent these blisters? If blisters has not burst, then it may be necessary to puncture it at the edge with a sterilized pin or needle. A pin can be sterilized by passing it through a flame. Drain the fluid, but leave as much of the skin as possible covering the wound. This is an important protective layer for the underlying skin and will help to prevent infection. Clean the blister with a sterilizing wipe. Cover the wound with a second skin of blister bandage. Another injury can be cuts or lacerations. A laceration is a deep cut in the skin or flesh. How do we treat lacerations? To control the bleeding, put pressure directly on the laceration while holding it above the level of the heart. If it's a major laceration, you will have to proceed to the hospital. For minor lacerations, use antiseptic ointment and close with butterfly closures. Cover the laceration with a sterile bandage and tape in place or with roller gauze. Watch for infection and change the dressing, the bandage daily.